A very large number of people have experienced serious trauma at some point in their lives. It may be in the form of physical abuse and violence. The CDC reports that 1 in 4 children experiences some sort of maltreatment, physical, sexual, or emotional abuse, and 1 in 4 women has experienced domestic violence. The upending of normal life by the COVID-19 pandemic has also been dramatic, causing billions of people around the world to experience unexpected emotional turmoil. Though many may not realize it, the emotional turmoil can, and is, causing symptoms of trauma to manifest in both children and adults. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter with AHA. In this podcast, Rebecca Chickey, Senior Director of Field Engagement and Behavioral Health Services at the AHA, is speaking with Dr. Glenn and Saxe about trauma, new traumatic events that seem to be happening every day, treatments for the impact of trauma, called trauma-informed care, and opportunities for hospitals to lead in improving access to this important type of behavioral health treatment. In addition to several other professional appointments, Dr. Saxe is director of the NYU Center for Child Welfare Practice Innovation.
So, Dr. Saxe, first of all, thank you again for being with us here today. I'd love if you could, before we get into the meat of this, tell us about your role at NYU Langone and any of the areas of specialty care that you really focus on.
Okay. Well, my specialty is trauma in children, and I run something called the Trauma Systems Therapy Training Center, which is the center for the treatment model that I created with my team called Trauma Systems Therapy, which we disseminate all over the country, including we're international in a few countries. I also run a National Child Traumatic Stress Network Center called the Center for Child Welfare Practice Innovation, where we're very focused on kids in the child and families in the child welfare system who are at risk to be abused and neglected or have been abused and neglected, and helping them get the best care possible.
Well, tell us, for those who may not know or may have a misperception, what is trauma?
Trauma happens when an event occurs which threatens someone's life or someone close to you's life. So you feel as if survival is at stake, and that changes a lot in people, for sure.
Many people I have heard continue to say that the effects of COVID-19, of the pandemic that we're currently experiencing both in 2021 and in last year, 2022, are having traumatic effects on everyone across the world, quite actually. Can you share with us what you think the short and long-term effects of COVID-19 are and will be, and particularly on your area of focus for children and adolescents?
Well, I used the word survival before, when survival is a threat. And we have an event, a massive event at global scale, where survival has been really challenged. The many people who have died. And so there is people who, your loved ones who have died. In my world, kids, parents, grandparents especially, who have died. Children have had to face grief, trauma, at the scale of which has not occurred in a very long time. So there is that. And then even if there isn't someone close to you who have died, there's something called a protective shield. And what that means is we get by in a way thinking that our world is relatively safe and predictable. And often the things that tell us that is that our life has certain routines within it. Things are expectable. We know what to predict, but at a massive level, that has changed. If you think of almost every aspect of daily life, um, COVID has hit, and that shakes people.
Very much so. I know it's shaken me, my family, my friends, and it felt like for a few months that we might be coming out of it, and now it's back again with a vengeance. I would assume that the effects are continuing. With all these challenges, what can we do to address this?
Well, first of all, kids look to, I'm talking from the perspective of children now, because that's really
Certainly.
the world I work in. Um, Kids look to adults around, will I be okay? Will I be protected? And there's obvious things that adults are uncertain about, but kids need to know that whatever happens, they have people in their corner who are behind them, who will be with them to face whatever our family will face. And it's actually sometimes people ask me, well, what words do I say to my child? And and I think it's more the music actually than the words. The music being, I'm with you, whatever. My job is to protect you and help you, and I'm here for you. I think depending on the kid, you're going to use different words depending on their age, who they are, whatever. A key thing is to be attuned with your child for sure, so you could know a little more what to say. But the basic principle, we're together here. We're going to face whatever together, and I'm here for you.
Great and wonderful advice, something I think we can all apply. But I'm curious, I've heard of something called trauma-informed care. Can you describe what that is?
Sure. And it is a word that means sometimes different things to different people, but in essence, it means problems that involve trauma, and the sequela of trauma. It is a treatment that is directed at helping. There are treatments out there that address traumatic stress, post-traumatic stress disorder, and other sequelae of trauma. And so that really is what it is. It, in our treatment called trauma systems therapy, which I think is pretty commonsensical work, there's kind of two aspects that have to be attended to. The first aspect is when someone, and I will say, it's not everyone who has experienced a trauma that will get a clinical condition that follows it. So people and families and communities are resilient. So depending on how you count, between 15 and 40% of people who are traumatized will get a psychopathological reaction to it that needs clinical intervention. Now, that's a lot of people. A lot of people are exposed to trauma. So there's a lot of people, but I do want to say that people there is a lot of resilience in people and communities. So I want to say that. But if you happen to have a response that needs attention, there are two aspects of it. One, your sense of safety is shaken, and you will react um, in a survival laden way to things that may not objectively threaten survival. It will be because things remind you, even in very subtle ways, about what happened to you. And your emotional regulation will be really off, and you could respond extremely. So, for that, there definitely needs to be intervention to help you manage your emotional states when you are triggered, so to speak. The second is that a lot involves what goes on around you. Your parents, your teachers, um, if you're an adult, whoever, your spouse, your people who are close to you, and how attuned are they to what you're going through? How much do they know what might trigger you so they can help create an environment that's safe enough for you? And I would say that both of these things are really, really important in any sort of trauma-informed care.
So I know you've spoken a lot, and your area of expertise is children and adolescents. But let me ask you to broaden this a little bit more and think about hospitals or health systems, because within those communities, many of those employees or clinical staff who may not be employed, uh, they are experiencing the impact of COVID. They're experiencing the different types of trauma that existed prior to COVID, domestic violence, community-based violence, and all of that also may have an impact on many of them that have children and their extended families. Are there things that you might suggest? It's interesting that you mentioned a sense of safety and the environment as two things. Are there things that you would suggest that hospitals and/or health systems might consider doing or raising awareness of in order to begin to enhance what they have been doing? As I'm sure you know, hospitals work long and hard to create an environment of safety for our employees. But the world, quite honestly, isn't completely safe. So what can our hospitals and health systems do to help address this?
Yeah, you're asking a critical question, of course. And I think the most important thing is to, employees don't like, usually don't like to share with their institutions how much they're suffering. There's stigma to this. People want to show their competence at work and all of that. But we've all together experienced this massive trauma, and people at various levels are suffering. And so the more um, supervisors, people who oversee workers could be aware of this, make it bend over backwards about you wanting and showing that you really do want to know if people are suffering. Um, Being attuned to your employees, people who may be acting other than they've acted before, people who might seem a little too more withdrawn, people who may seem, you know, irritable, uh, people who are not quite acting themselves, and create a space where you might check in and it be perceived as safe to do this. Again, underlying all of this is systems of the brain and body that are tuned for survival to help someone, and it gets shaken here. And so people need to know it's safe to be able to discuss things for sure.
As you were talking, I hastened back to Psychology 101. I have an undergraduate dual degree in business and psychology. And I thought, in essence, if I hear you correctly, we're threatening Maslow's hierarchy of needs. We're being taken down to the more baser instincts whenever we experience trauma, and so you have to build it back up. Is that?
Oh, exactly. That's a great way of putting it, for sure. I mean, survival is the most basic need. And there's a lot we create in our lives to help with survival. But then it gets overwhelmed. I mean, this is a context in which it's massively overwhelmed. Again, I mentioned earlier, I mean, the routines we create for ourselves are often means of creating a safe world, a predictable world, a world in which we know what's coming next. And that gets shaken. And you mentioned earlier, well, what about people who've experienced trauma before this has happened? And so, you know, assuming people are on paths to recovery, they've had an event or events in which their sense of safety, security, survival was shaken, and they may have exerted as much as humanly possible of coping skills and strategies to get back to um, a normal state in which they are feeling good, safe, productive, and boom, the world changes.
So you've given us some wonderful things to think about. Really be there for your staff. See what you can do to enhance the routines, because I think that applies to adults as well as children and adolescents,
For sure.
to help build on the culture of safety and reinforce that they are working in a safe environment, because their belief that it is safe has been shaken.
Yeah.
Is that accurate?
Oh, yeah, yeah.
And we have stood up. I'm wondering if there are any particular reading resources or web pages that you might recommend if someone wants to do additional research on this. Like, what can I do? Are there places you would point them?
I would go to, for children, to the National Child NCTSN, National Child Traumatic Stress Network website, and I could give you that website. And then for adults, the National Center for PTSD, which is part of the Veterans Administration, but they have great resources for any adult trauma and kid trauma. But for kid trauma, the NCTSN website is a great resource.
We will post both of those web pages on our stress and coping resources page that we stood up, I want to say March of last year. So we'll make sure that those, along with this podcast, get posted. And a shortcut to that web page, just for those who are listening, is the vanity address, as they call it, is aha.org/behavioral health. And then at the top, you'll see a carousel and stress and coping resources will come across. So we'll make sure that your wisdom and your experiences that you've shared with us here today are posted there along with those resource pages.
Great, great.
Dr. Saxe, thank you so very much.
My,
Really appreciate your time, as well as the work that you're doing on a daily basis to increase the resiliency and the safety of our children and adolescents. So thank you very much.
Thank you. Great to talk to you.